Thank you for joining in today for this episode of The Advocate, a production of the American Society for Gastrointestinal Endoscopy that informs physicians and patients on emerging healthcare topics impacting GI. ASG represents over 14,000 gastroenterologists worldwide and is the leading voice for GI endoscopy.
Hello, everybody, and welcome to this episode of ASGE The Advocate. I'm your host, ASGE Immediate Past President, Dr. Klaus Mergener, and I'm very pleased to have with us today Dr. Victoria Gomez. Victoria, welcome.
Thank you so much, Klaus. Thank you to the ASGE.
It's very nice to see you. Just very briefly for our audience, Dr. Gomez is an associate professor of medicine and the director of the bariatric endoscopy program in the Division of Gastroenterology and Hepatology at the Mayo Clinic in Jacksonville, Florida. She's also an associate editor of our journal Gastrointestinal Endoscopy. Dr. Gomez is originally from Santiago, Chile, and moved to Texas and this country at an early age. She told me that she was inspired by her parents, who are both retired physicians, to go into medicine. And Victoria and I share in our CV that our respective spouses both studied medicine in our medical school class, and that's how we got to meet them. And they're also both surgeons. Dr. Gomez and her husband couple matched at the Mayo Clinic in Florida, and that's how she ended up there, doing her internship and residency and then GI fellowship at the Mayo in Jacksonville, and then spent a year of advanced endoscopy training at Mayo Rochester before returning to sunny Florida. So once again, Victoria, welcome, and I'm looking forward today to talk to you about issues related to diversity, and specifically as regards the clinical trial situation in this country and challenges related to diversity. You are, of course, not only a very active ASGE member, but you're a member of our Diversity, Equity, and Inclusion Committee. So could you, to get us started, tell us a little bit about the issue of diversity and clinical trials in this country?
Thank you. Thank you, Klaus. Right. Well, first of all, thank you for this invitation to participate in this episode of The Advocate. You know, there's been so much activity and positive light shed on this area of diversity, equity, inclusion, or DEI in the field of medicine. And our DEI committee has done just a fantastic job at highlighting some of the ongoing efforts, for example, to improve colon cancer screening awareness and providing more resources, as well as increasing the number of underrepresented minorities in medicine. But again, an area that really deserves special discussion, especially with the current pandemic that we are all experiencing and living in, is the status of clinical trials participation. You know, without doubt, recruitment and participation in clinical trials is absolutely crucial for the development of effective medical therapies, treatment strategies, and progress in medicine. But interestingly, as I progressed in my early career as a physician, you know, probably many of my colleagues and we probably did not even give it a second thought on how these clinical trials were being conducted. You know, who were the participants? Where do they come from? How did they hear of these studies requesting volunteers? And what all was involved with enrolling, participating, and following up in a study? And it really wasn't until these past several years, now being out in practice, and with the unfortunate events and social injustices that have occurred in our communities, but you know, particularly targeting our fellow members in underrepresented groups, that our society, I feel, has started to take more tremendous steps towards working on narrowing this gap and disparities in medicine. And furthermore, with the pandemic that we are still in, you know, there was an emergent need to find effective vaccines and medical therapies to combat COVID-19.
Right, and really a critically important topic. Can you tell us a few more details in regards to clinical trials and diversity, and maybe what some of the current gaps are in the field?
Absolutely. So just as recruiting and retention of clinical trials are key factors for success in clinical research, the diversity of the participants is just as, if not more important. Without adequate research across diverse patient populations, the trial results can be skewed. They can provide false reassurance and provide data that is not generalizable. So furthermore, unbalanced trial results can give rise to doubt and even reduce participation from underserved or underrepresented groups. So I started to do some reading because I thought this topic was just very appropriate for the times that we're living in and an area that I think we're really focusing more on. And interestingly, despite our efforts to improve the diversity of subjects enrolling in trials, there are still very real challenges with participation, and underrepresented minorities continue to be underrepresented. So for example, as reported in 2011, African Americans and Hispanics comprised 12% and 16% of the US population respectively, but only 5% and 1% of trial participants were African American and Hispanics respectively. So then you're looking now at 2016. So by 2016, the US population included approximately 13% and 18% of African Americans and Hispanics respectively. But even despite these changes in our demographics, we still project that more than 50% of the US population is going to be other than non-Hispanic white by 2045. And so lack of diversity in clinical trials is a moral, scientific, and medical issue. I came across a multinational survey to assess the impact of the COVID-19 pandemic on levels of the public's understanding, perception, and experiences related to clinical research. And the lack of trust in pharmaceutical companies ranks lower than other research stakeholders and results in even lower participation within minority communities in clinical trials. If you dig deeper, there are many other barriers that deserve mention. These include issues with literacy or understanding or being able to read something simple such as a flyer announcing a clinical trial. There are those people who may have limited education or in whom English is not their first language. So starting off, dissemination of information itself can be a key limitation. Many of us may pause in front of our elevators at work while we're waiting to ride it, and you may see several flyers looking for volunteers and participants in studies. To us, we all know how to read English, we understand what is being asked, but imagine what thoughts may be going on through a lay person's mind who is not medically savvy or may not even understand what these words mean. Or you could go to a local church where many of the members may not be primarily English speaking, or maybe in an area where healthcare is not readily accessible. So these are some real legitimate issues. So other issues to consider include time and resource constraints, such as lack of transportation to participate, financial burden, and compensation issues. We also have issues such as not having language interpretation resources available, as well as maybe not being culturally sensitive to the populations that a study may want to approach for enrollment. So to add to this list, how many of us walk around with our smartphones? There are certain groups and populations that do not even have access to these devices. So this can make advertising, enrollment, and retention very difficult.
Yeah, an amazing list of issues and hurdles and gaps that need to be addressed. And as you pointed out, I mean, it's frightening to think that until very recently, many of these issues have gone, if not unnoticed, then definitely unanswered. So much work to be done there. Can you talk to us a little bit about what big organizations like the Food and Drug Administration, for example, are doing to improve industry practice with regards to clinical trials and diversity?
Yes, certainly. So there are fortunately several published regulatory guidances and scientific papers that focus on improving patient diversity and inclusion. So in November 2020, the US Department of Health and Human Services and the Food and Drug Administration, or the FDA, published recommendations to help increase enrollment of underrepresented populations in clinical trials, as well as enrollment strategies that include representative proportions of relevant age, racial, and ethnic subgroups, which are consistent with the intended users of a device or drug, for example. I mean, simplistically speaking, if our society wants to implement a new device or medication to treat a condition that is prevalent amongst a broad range of ages, for example, then the clinical trial participants need to span across this age group and not be skewed towards just one extreme of ages. This is the same with a condition that is prevalent across all races or ethnicities. Also, a new industry consortium was recently launched to address the crucial need to improve patient diversity in clinical trials, focusing on activities to support community-based education with the goals to improve general knowledge about the clinical research process amongst minority groups. These are just some of the examples of efforts being put forth from these big organizations.
Very good, thank you. And last not least, talk to us a little bit about what ASGE is doing to raise awareness on diversity and GI-related research and on healthcare disparities.
Well, I'm very proud of the ASGE. We just have a lot of activity and a lot of great endeavors going on at the moment. So to start off with, our editorial board at Gastrointestinal Endoscopy, which is our journal for the ASGE, is very committed to diversity, equity, and inclusion in all aspects of our publications and business. So us members at GIE partnered with the DEI committee to create a diversity forum for authors submitting their work to GIE. So we provide authors with the opportunity to tell us and our readers how diversity, equity, and inclusion were implemented in their studies, highlighting best practices, for example. I think having this information available to the reader provides a better understanding and interpretation of the results and conclusions. We always take results and conclusions of these studies at face value. But I think understanding the patient population that was studied helps us to determine just how generalizable some studies really may be. Second, as you may have heard, one of the ASGE's action plan priorities is to expand healthcare equity and access to GI care. So one of the strategies for us to meet this priority is for ASGE to support research and the career development of GI researchers in healthcare disparities. So to kick off the society's efforts, the ASGE developed an annual $50,000 Diversity and Inclusion Award. The objective of this award is to promote studies that advance the field of gastroenterology research and focus on minority health, as well as healthcare disparities as it relates to GI disease. This award will be included in ASGE's current research awards cycle, and the deadline to apply for this award is December 10th. We have included the announcement in the ASGE resource room as well, and we hope that this award will assist the awardee in securing additional funds to advance research focused on minority health and GI. And last but certainly not least, we are also very involved with Congress. So we are providing feedback to government agencies such as the NIH and policymakers on how to increase diversity in clinical trials. Just recently, on July 19th, we provided feedback to Representative Anna Eshoo regarding legislation she is considering to ensure diversity in clinical trials.
Wonderful. And thanks again for just a fantastic overview, very comprehensively done. And I'm hoping that our viewers have a better understanding now of not just the magnitude of the issues related to diversity in clinical trials, but also some sense of what we at ASGE are doing in this regard. I'm wondering, Victoria, before we wrap up, if you have any key thoughts, any final take-home messages for our viewers.
I do. I would like for all of us to take a step back and look at clinical trials from a humanistic point of view. You know, these participants that decide to enroll or volunteer these studies are people just like you and me, Klaus. These are volunteers. They allow themselves to become vulnerable for the purpose of advancing science and medicine. And this is where the art of medicine comes into play. This is where we can make a big difference. As medical providers, there's so much that we can do to help with the efforts in removing barriers to clinical trial participation. We can actively engage in conversations with our patients, encouraging them to seek more information and helping them connect with the pertinent personnel who can answer their questions. And most importantly, we can help reinforce their personal health, working with them to ensure that their health and safety are our biggest priorities. Patients do not want to feel abandoned, and whether they decide to enroll in a clinical trial or not, we should never abandon them and we should support them 100%. If there are certain underrepresented patient populations that one may care for, make an effort to inquire about their thoughts on participating in clinical trials. Figure out if there are misperceptions or barriers, skepticism or fears that you could help address even during an office visit, and determine if there are educational or language barriers that can be dispelled, for example. If you yourself take on the role as a primary investigator and are leading a trial, consider you yourself going outside the clinic to provide informational sessions, or maybe with Zoom meetings, to your local community, and take the time to answer questions. These are just some of the small yet very impactful actions that we as physicians and medical providers can take to work individually with our patients. We are all in this together, and ensuring diversity, equity, and inclusion in clinical trial participation is extremely important.
Very well said, and perfect final thoughts for this interview. So once again, I want to thank Dr. Gomez for making time today and for addressing some really important issues. Victoria, thank you so much.
Thank you so much, Klaus. Thank you, everyone.
And for everyone watching us, first of all, I know you're all vaccinated. You hopefully are, but please, let's all keep our efforts up to get all of our friends, our family, all of our patients convinced that vaccinating is the right thing to do and get done. And from all of us at ASGE, once again, thank you for watching. And we'll catch up with you soon on the next episode of ASGE The Advocate.